What if I told you of a place where you could get advanced clinical care, but also social service support? This place is called the Healthy Village at St. Francis Hospital in Wilmington, Delaware, a new model of healthcare. Today, I'm joined by Lil Schonewolf, the Vice President, Community Health and Wellbeing for Trinity Health Mid-Atlantic and Executive Director for the Healthy Village. She discusses how we are reinventing the wheel at St. Francis Hospital to offer whole person, whole life healthcare. I'm your host, Margie Zimmerman, and this is Beyond the Stethoscope. So, Lil, thank you so much for joining us today to talk about the Healthy Village.
Oh, it's great to be here and it's great to be with you.
So, in a few words, can you tell us what the Healthy Village is?
Sure. So it's an opportunity to provide whole person care for all of our patients, meaning that they come to St. Francis to receive all their healthcare needs, their clinical needs, acute services, surgery, emergency services, which we will always continue to do, especially in this community because it's so needed. It's a very underserved community. But what we decided about 2 years ago is we learned about a healthy village concept. And after a lot of interviewing on community itself, legislators, and a lot of our board members, we thought about what is it that our community really needs? What is it that our patients need? And although we provide this great service, we have a hospital that's like 400 beds that we do not fill up. We probably fill up maybe 70 at most. And so what do we do with all this underutilized space? So the idea of a healthy village is to be able to provide all the social services at the same time that we do clinical and health services.
It's a wonderful concept, and I'm sure it's really needed in this community. Can you tell us if St. Francis Hospital is the first hospital in the United States to offer this model of healthcare at
There's
a hospital?
yes, yes. So there's healthy villages throughout the states. We did talk with a consultant that has opened up various healthy villages. One very close to St. Francis in Milford, Delaware. And the difference is that those healthy villages are collaborative efforts of social services, but they might have a physician or some type of practice at that location, but this is the first time anywhere that all those services will be inside a hospital. So it's not going anywhere outside. Once you come in, we're able to help you with any of your social needs as well as your clinical needs.
Like one-stop shopping for healthcare.
Yeah. And sometimes what happens is, a person comes into the emergency room, and unfortunately, when you have, especially those that in a community where people don't access healthcare easily, they often use the emergency room as their primary source of care. So if they come into the emergency room, we do a great job. We make sure they're admitted. We provide them everything they need. But then at the end of that visit, we say to them, how's your home life? How often do you eat? Do you have any issues with violence? And if they say yes, we provide the resources, but then they go off. So we don't know what happens. Do they have the ability to get that help? Do they have the access to get that help? Do they even understand what we just explained to them? And so often they'll leave and end up back in our emergency rooms, oftentimes with something that could have been prevented, either physically or could have been prevented by providing either behavioral health or mental health services or even substance use disorder services. And so this is an opportunity to really focus on the individual wholly.
So they can get them set up that same day with the care that they need.
Correct.
That's wonderful. That's wonderful. So tell me more about the mission of the Healthy Village.
So when we started this process, we really wanted to, we already knew what the community health needs assessment says. We do that every 3 years, but we really wanted to hear from the community what they like about St. Francis, what they don't like about St. Francis, and what are their real needs? What is it that keeps them up at night? And so I would say probably 90% of the interviews that we did, which again were community members, we did a lot of door knocking. The needs were really focusing on 4 different areas: workforce development and education, senior services, affordable housing, and behavioral health, mental health services. And so as we took that survey and we said, okay, these are the 4 areas of need that we need to concentrate on. If we're going to turn this into a healthy village, we have to make sure that we're listening to the community. We don't want to make decisions for them. We want to make sure that what we plan is with what their needs are. And then we focused on how does the community view St. Francis? And pretty much everyone that we talked to were at first worried that we were closing because they
Yeah,
felt this is their
that's their
community
community hospital.
hospital. This is where they go. This is where they feel that they can be trusted. Another part that really impressed me was that many of them felt safe. They felt that, our clinical teams and our care teams knew that they were dealing with social influencers in their life, but they didn't make that as the, the focal point of caring for them. And so we knew we were on the right track saying, okay, we're going to keep the hospital going as we always had planned, continue acute services, ER, surgeries, what have you. But now let's focus on these 4 needs. And how do we collaborate with the best organizations here in Wilmington that can help us to make sure that we're providing those services?
Who are the current partners at the Healthy Village currently?
So we have Marquee Services. This is the first time they're serving in Delaware. They do mental health, behavioral health, and they also do substance use disorders. And so right now we were able to receive a grant about 18 months ago where they are providing what's called a wellness recovery team. So they're the team in the emergency room, and they also will be located on the 5th floor.
And this is for mental health?
Yes.
Oh,
And
wonderful.
so
Oh,
what
this is so neat.
yeah, and it's really great because the team itself, if you come into the emergency room, the clinical team sees that they really need their help. The team, the point of it is for them to then meet with that individual. It's a nurse, a case manager, and a peer support. That peer support person is the most important of that trio.
Mhm.
That's the person they're going to connect with. It's someone that's gone through what they're going through and will handhold them through the process. And so they take it from there.
Yeah, so again, they're getting the care immediately that they need instead of being held in a bed and then waiting for someone else to call someone to get them. They're getting the care that they need immediately, which is so important.
And then the next part of theirs, what they'll be producing it or making available to us is they will take what we had the St. Clair van that was providing healthcare, mobile services. They're going to be able to provide not only primary care, but also behavioral health services. And so on that mobile service van, we'll be able to have food. We'll be able to have some items that folks may need.
So this van goes
Unfortunately,
out into the
yep, they'll be
community?
starting soon. Yep.
Oh,
So they'll be
wow.
going out. One of the other things that we're really proud of is that the main lobby of the hospital, as people come in, what we want to have is a community health worker right there. Community health worker welcomes you, really starts to feel what is it that you need? Is it that you need to
That like
see
a
one of the
triage?
partners?
Like, is that like a version of a triage in the emergency department when you have someone like that
More
there?
like a greeter.
More like a
Yeah,
greeter,
more like
but
a
can put you
greeter
in the
that
right direction of what service you would need
yep. And it has to be somebody from the community, someone that lives in the community, knows the community,
where they feel
maybe
safe.
even know them as they come in the doors, and then be able to say, okay, let me help connect you, whether it's the hospital or whether it's one of our services. That lobby is going to be transformed into individual offices so that some of our partners will take up full units and some of our partners will only need an office here because we don't want any of the community resources to leave the community. We want to make sure that they stay there, but there's someone that's here in the hospital to connect those resources right away. And so they'll come into the lobby, you'll see various organizations represented there. But also, what we did was we're changing what was once the gift shop of the hospital, and it's now a community health center. And so in there, we have what's called the CARES program. So it's community aid refurbished equipment store where if you come in, you might have Medicare, Medicaid, and you may only get one form of medical equipment, whether it's a wheelchair or a transport chair, right? Or for toiletry, you might get a shower chair or you might get something else. This way, it allows individuals to come in, take equipment that has been donated to us, and they
And
take it
that's
for
free of
free, and
charge
that's
to
free.
them.
Yep.
That's wonderful.
And then also in that same center will be supplies for maternal care. So
And
we
this will
give
be in
out,
the same
yep,
area?
yep. So we'll be giving out, or they already started giving out formula, diapers. We have also do food through the right there through that center. And then the next part of the phase will be, how do we assure that we're providing the community some expertise? Maybe it's financial stability, financial planning. How do we get, there's a very large population in Wilmington that they're 18 years old, they aging out of foster care, but sometimes they didn't get their high school diploma and then obviously certifications for other things. So, how do we make sure we're connecting right now with middle schools and high schools in making sure how do we provide a mentorship program? Because we have plenty of colleagues who want to participate in this as well as our partners and be able to go through the process of if you stay in school, this is the kind of job you can get. And so, if you don't have a high school diploma, can we have someone in the building to provide you with that? And at the
To
same
help you to
time,
help
to
them with
help you
that, to
with
get their
that.
GED.
Yep. And
And
then at
that's all
this,
right here in the
it
Healthy
could, right,
Village.
that's
Wow,
the plans. And
that's the
so,
plan.
but at the same
It's
time,
wonderful.
be able to, maybe they want to get certified as a nurse aide, or maybe, we have all of the trades here, electrician, plumbing, all of those are here. We have a Department of Health regulated kitchen, could do culinary studies. So there's a lot of different ways we can do it. There's a lot of interest from various colleges, but our focus right now is let's start small and let's go academic steps to see how individuals can go. So being able to provide them the help in classes, how do you do a
So
resume? How do
important.
you do an interview? Why do I need that type of job? So doing that at the same time to show them, well, if you make this money, you can afford this type of housing. Or if you
Exactly.
do this, you can do that. The whole focus here is taking care of the community, making them a stronger community, a healthier
This is
community,
so
both
needed.
its social aspects of it, trying to eliminate some of those determinants that unfortunately influence a person's life, as well as the healthcare.
Wow, that's amazing. It's incredible.
So I know you
So,
asked me about the other partners. I'm
it's
sorry. So
well, I was asking you, like, what are the benefits for partners at St. Francis? So, if someone wanted to become a partner at St. Francis Healthy Village, what are the benefits to them?
so if you think again about that person and being able to take care of that whole person. So many of these partners, um, they may have expertise in food distribution. They may be linguistic services, child abuse. They may have those specific services, but they need the connections of all the other needs that individual may have. So being able to be here in the building, because the idea is not only for these organizations to collaborate with us, but to collaborate with each other. And so making sure that their mission ties in with our mission. And then if you look, for instance, we have a women's reentry program through the Hope Commission that's here. Being able to provide all these various resources to help them with the resources that they have to be able to help women to get back into the community and feel not only healthier, but determined and more and trying to give them more confidence.
Howard.
So that's what we're trying to do. So for partnerships and for healthcare, it's a great collaboration in that we're here in the building, right? So if someone does need any type of healthcare needs, obviously we can provide that. Some of our partners, for instance, Marikey, they're looking to do an FQHC. So if they do primary care here, working along with our family practice, working along with our residents, then the benefit is that they can use our ancillary services, lab, radiology, and all those services, and security. So it keeps everybody busy
Yeah,
and really utilizing the whole building, but at the same time taking care of our patients or our community.
which to me is the most rewarding benefit of all, to be able to help individuals and empower them. So, looking ahead to the rest of the year, what does the Healthy Village have planned?
The main emphasis right now is going back out and re-engaging the various organizations that showed interest to be here in the building. Whether, I talked about some will take up full units, like hospice right now has a full unit, right? The Moors maybe looking to expand space. So those are bigger partners that will take up large portions of the hospital, let's say. The other part is re-engaging these smaller organizations to say, how much space do you need? What would you like to do here? How could we work together? So we need to really restart all of that. And so that's where I'm spending most of my time back in the community, meeting with people, meeting with organizations. And each time I go to an organization, they say, "Did you meet with so and so?" So that's five
That's
more
great, spreading the
organizations.
word
Yes. So
of
I
what we're doing.
feel like that's all we're doing these days, but that's the most important is making sure that we're making those connections and to really explain, because I think a lot of people are still confused of what Healthy Village is. It's not separate. St. Francis is the Healthy Village. The purpose and the reason St. Francis is here is a healthy village,
Yes,
right? It
yes,
provides help, but at the same
makes sense that
time,
what the name is Healthy
yeah,
Village.
we just want to collaborate with those that are already doing these services in the community.
Yeah, and I'm sure the more you talk about it, I'm sure there's so many good people and organizations out there that want to get on board with this to help this community.
Yeah. And
So,
there's a lot of our time right now also is in advocacy, funding for social determinants and what we're doing, and this can change healthcare. And think about it, that same person we talked about earlier, not being readmitted time after time, or being able to not have them in here longer than they need to be, or maybe it's the support they need at home. How do we provide that? So that's a benefit.
yeah, especially when it may be a call for them to get help and then they come in another place they could go in and then they go back out again and they don't get the help they need. So, this is really important. This is great. Um, so, what types of organizations are you actively looking to partner with?
Right now, our focus is on workforce development and education. We've had many conversations from middle school level through the university level. So what we're trying to figure out now is, where do we start? We're not about reinventing the wheel. We're experts in healthcare. We're not experts in some of these other sources. We know where it's needed, but we are really needing to get the experts to talk to us to say what works, what hasn't worked. Um, could we do it together? And so right now, that's what we're building is, let's determine where we start, how we start, what programs are most needed. And at the same time, we want to finish up Main Street, which is that lobby area.
So, Main Street is the lobby area of the hospital. Okay.
And it also will have a big conference room so that these organizations can come and meet there.
To collaborate together.
Yeah.
How wonderful.
Yep. And the other part is we're thinking, probably going to need some kind of computer room, technology room. So as much as we finish up Main Street, it'll be also re-engaging with both bigger partners and smaller, because this isn't a project. Sometimes people are still confused about it, right? And so they'll think, okay, well, when's your grand opening? Well, we already
And
opened. We
yes.
already did as soon as the first partner came in. When will it end? It won't. This
So
is
you're going to
something that will
continue. This is
continue.
something that's going to continue to grow and benefit the community and change as things change.
And the needs change. Community, unfortunately, we call Wilmington a small city with big city problems. And so, as those needs change, then we have to make sure we have those resources. And we're not going to fix everything, but we need to make the effort of collaborating with everyone that is an expert in some type of social determinant so that we can provide that help and collaborate that to get that need taken care of.
Well, Lil, this model of healthcare is much needed for the community here and even for other communities. And I'm so happy that you were able to join us today to talk about the Healthy Village and exactly what it is and how it is helping the community here. So, I can't thank you enough for, sharing everything about the Healthy Village and letting our listeners know what we're doing at St. Francis Hospital here in Wilmington, Delaware. So, thank you so much.
It was my pleasure. Thank you.
If you would like to learn more about the Healthy Village at St. Francis Hospital, please visit us on our website. Thank you all for joining us today. Please stay tuned for future episodes of Beyond the Stethoscope.